everyone. We're just giving everyone a little bit of time, a few minutes, a few seconds actually, to let everyone come in. Okay, I think we are good to go. Good morning, good afternoon, good evening, everyone, in whatever part of the world you're joining us from. I would like to welcome you to today's Grand Bargain Cash Workstream subgroup webinar, which will focus on the topic of keeping recipients of humanitarian cash and social protection informed, the importance of outreach and communications. My name is Carla Lacerda. I am UNICEF's Cash Partnership Specialist outposted in Switzerland, and I also coordinate the Grand Bargain Cash Workstream subgroup on linking humanitarian cash and social protection on behalf of the co-lead agencies, UNICEF, FCDO, and IFRC. I wanted to take the opportunity today to briefly give you a bit of background before we get into the substance of today's discussion. For those of you who don't already know, the Grand Bargain subgroup aims to reinforce the dialogue and knowledge sharing between humanitarian development stakeholders to support the linking of humanitarian cash and social protection in the time of crises. This particular area of work on knowledge management within the subgroup is led and funded by UNICEF and also encompasses the distribution of a fortnightly newsletter and soon to be published case studies, which have been developed using contributions from all of you, subgroup members, who were also central to the research and drafting process. This group has been running for just over a year now, and it is currently in the process of determining its future beyond the Grand Bargain Cash Workstream from June 2021. So subgroup members have been provided with a survey for their inputs by the 26th of April, and we look forward to the outcomes of that. I also wanted to take the opportunity to make a quick announcement on behalf of the subgroup co-leads with regards to the Humanitarian Network Partnerships Week, which is the HNPW, which will be running virtually throughout April and May. So this year, the HNPW will host two important Grand Bargain subgroup sessions. The first one is a panel discussion on social assistance in crises, examining emerging evidence, policy, and practice at the interface between humanitarian cash and social protection approaches in crises. And it will be hosted on the 26th of April at 2 to 3 p.m. CET, which is Geneva time. This panel will be facilitated by Paul Harvey from Humanitarian Outcomes, and it will be made up of representatives from SPACE, UNICEF, and WFP. The second very interesting session is a clinic on what have we learned on linking humanitarian cash with social protection, which will be hosted on the 27th of April at 11 a.m. to 1 p.m. CET, Geneva time. This session will be hosted by the Grand Bargain subgroup on linking humanitarian cash and social protection, the online community on social protection crisis, CALP, and the FCDO funded Better Assistance in Crisis Basic program. It is designed as an interactive session that will provide tailored peer-to-peer advice on specific practical questions related to the design and implementation of humanitarian cash transfers that leverage social protection systems, align with or complement them, or contribute to their strengthening. If you're interested to attend and actively engage in the clinic, please send your questions to the organizers ahead of time through me, cdelacerda@unicef.org. I'll pop that in the chat so that we can maximize time, discussion, and exchange opportunities. We also encourage participants to listen into the panel discussion on April 26th. So members interested to participate in these sessions must register themselves online at the HNPW website, which is being shared now on the chat along with the title, date, and time of the session. This link leads you to the registration and the full event program. So please note that in order to find the sessions, you will have to painfully scroll down to the date and time of the session, which is why we have written them down here on the chat for your ease of reference so that you can easily find it and register. Now back to today's program. Today's webinar will provide the opportunity to hear from 5 expert speakers who will share with us learning in relation to keeping recipients of humanitarian cash and social protection interventions informed, including approaches to outreach and communications and some of the challenges they experienced. Following the presentations, there will be the opportunity to ask the experts questions. So please send your questions to the Q&A box, ideally stating your name and organization. and who you are addressing the question to, and we'll try to respond as many as possible before the webinar ends. We will do our best to provide written follow-up to the questions we don't manage to answer after the webinar, which will be available on the sp.org site. Now, before I introduce you to our speakers, we will start the webinar with our usual poll to get an idea of who's participating. This will help our speakers know how to tailor their comments and interventions. So you should be seeing in your screens now a survey. So please select which one you fit in. If you're a social protection actor, humanitarian actor, a combination of the two, or none of the above. And I'll let this run for a few seconds and count down to closure. This just will give us a little bit of an idea of who you are before we give you an idea of who the speakers are. Okay, countdown, 4, 3, 2, 1. Perhaps the results, if we can see them now. Okay, so we can see that the majority are actually social protection colleagues joining us at 36%. We have both at 28%, which is fantastic, and humanitarian 21%, and neither 15%. So you're all very welcome. Now, it is my pleasure, without further ado, to introduce you to our speakers for today. So first, we've got Anna Prodanović. She is a child rights monitoring specialist with UNICEF in Serbia, where she leads on evidence generation and evaluation. She also oversees the social policy portfolio that has included a humanitarian cash transfer program to families with children impacted by the COVID-19 pandemic. Second, we have Ranko Demirovic, who is the disaster management coordinator for the Serbian Red Cross. Ranko is in charge of the development of the Serbian Red Cross disaster response system, as well as their life-saving and mountain rescue and emergency response. He is the cash transfer programming focal point. And Ranko has worked for the Red Cross of Serbia as well as volunteering for 5 years. He's a member of the International Red Cross and Red Crescent emergency response teams and is currently studying for a master's in international business and management. Third up, we've got Christoph Brummel, graduated with and has an MSc focusing on environmental risks and humanitarian security. Christoph has worked at the interface of humanitarian assistance and development cooperation for many years, including in Rwanda, DR Congo, and Nigeria. He is currently coordinating GIZ activities in Kakuma, Kenya. Fourth is Elphas Maiyo, and he is the Chief Public Health Officer working with Turkana County government. Elphas holds a BSc in environmental health science from Kenyatta University and has worked in the public health department for the last 10 years. He's currently coordinating community health services in the Turkana West sub-county, as well as holding a position of acting sub-county public health officer. And fifth up, we've got Max Seilern, is a program manager at Ground Truth Solutions, where he focuses on exploring the perceptions and experiences of cash and voucher assistance recipients across different contexts. As part of Ground Truth's Cash Barometer initiative, he combines standardized surveys with qualitative approaches to enable CVA recipients to provide feedback and participate in decision-making. Max holds a master's in global governance and ethics from the University College London and a bachelor's from Maastricht University. So what I will proceed to do now is we will go to our presentations, our expert presentations. And first up, we will have the presentation of Anna and Ranko, who will have a 5 to 8 minute presentation. We will then be led by Christoph and Elphas and Max in closure. So we'll have 3 presentations today. And please keep sending your questions on the Q&A box rather than on the chat box. so that we can monitor those and try to address as many of these as possible at the end of the presentations. So Anna and Ranko, without further ado, over to you.
Thanks a lot, Carla. And thanks to everyone for joining. I will be speaking a little bit about the cash transfer program that UNICEF initiated in Serbia in the aftermath of the COVID-19 pandemic. And this is work that started sometime last year, approximately mid last year. And we are in the process of distributing 2,000 cash transfers to families with children in the region of southern and eastern Serbia. So next slide. We thought when we started off that it's really important that the program is based on solid evidence, and therefore in during the time of the emergency in April and May last year here in Serbia, we initiated a telephone survey on the socio-economic impact of COVID-19 on families with children. This was really, really important because it gave us insight as to how the pandemic had actually impacted households. And I'll be giving a few statistics from that in a minute. We then went on to analyze the government's response to its cash benefits programs in the time of the pandemic. And we quickly realized that the government was not doing, not extending the existing cash transfers, neither horizontally nor vertically. And therefore we realized that there will likely be a need for additional assistance. And this is where we sort of mobilized funding from USAID and went on to really select the regions and municipalities of Serbia that were likely to be most affected and that were, in fact, prior to COVID-19 already most affected by poverty. We also try to select the best criteria that would fit the need at that point in time, and also really worked with the Red Cross, with whom we had an existing partnership on other fronts to further develop the program. Next slide. So basically what the survey that we conducted in April 2020 told us is that in almost half of the households at national level, income was reduced due to the coronavirus epidemic, and most often up to 30%, although in some cases it went up to 50%. Next slide. We also found out that every fourth household had unexpected expenses during the pandemic, and this was most often for hygiene items for food. And this really gave us a clear picture of what families with children might be facing and the deprivations that children were likely to face in the aftermath of COVID. Next slide. So very briefly, and Ranko will expand on the details of the program, but essentially we targeted southern and eastern Serbia. Some municipalities were selected based on existing poverty measures, and we tried to select households that were rejected for cash social assistance and for child allowance in the last 6 months. This was important because it kind of provided the link to the existing social protection system, and basically tried to really help out the people that had expressed the need for help but hadn't been able to receive it. We also gave priority to single parent families and families with 3 or more children, and also had several other vulnerability criteria. Our response was based on amounts that were determined based on the minimum expenditure basket. And we opted for distribution of debit cards, which we thought would help both with social inclusion and with COVID-19 hygiene considerations. And we set up a pre and post distribution monitoring system to really closely analyze the effects of the program. So I'll hand it over to Ranko now to give a few more details.
Thank you, Anna. Hello, everyone. Thank you for being here and listening to our example from Serbia. So maybe I should add something about the context in which we were working for implementation of this CBA project that we are implementing in partnership with UNICEF in Serbia. So, as you probably know, there were a lot of peaks related to COVID crisis in Serbia. So, in time while we were mapping the households with children, we had the highest peak in 2020 year in this period. So there were some kind of restrictions on how we could organize ourselves to reach the most vulnerable ones with children. So something that we have done, we have used the local network of the municipalities. As you probably know or not, the structure of the Red Cross of Serbia consists of 186 local Red Cross branches in cities, provinces, and municipalities. So this gives us a possibility to cooperate with all local stakeholders, governmental and non-governmental ones. So during this COVID-19 crisis and peaks, how we were reaching the potential beneficiaries, households with children, we were cooperating and exchanging data with the local healthcare center, also with the local social welfare departments, local self-governments, and also with local community representatives. So representatives that could be the representatives of the government in the community, or they are volunteers of the Red Cross in this community. So we were receiving information from these, let's say, the lines of communication, and we were creating the pre-list for field interviews and final selection of the people. So next slide, please. Something that was additionally done by the some local Red Cross branch was using a media as an additional channel for communication with potential beneficiaries of this cash assistance program that we are implementing in partnership with UNICEF. So we have in this time of COVID a great reaction from the population that they have received the information that we said we will do this, and this criteria will be like this. We are asking people to call us and come to the local Red Cross branch for interview or for some more informations. So this was additionally conducted, and our pre-list for field intervention was getting, let's say, bigger or wider. And after that, we started with concrete, next slide, please, with concrete implementation on the field through the whole CVA cycle. So we were doing the field intervention, going to the field if it was possible, all communicating with families via phones or via another devices. So we have used this field interviews to make the selection process, and also to conduct some verification where it is needed. And this also helped us to get to the final list of potential recipients of assistance that we are providing with this program. So this part of the mapping of the potential beneficiaries and reaching community, communicating with the households with children was something that Red Cross is proud now in this program that we are implementing in this in partnership with UNICEF. So thank you.
Thank you very much, Ranko, for this presentation. There are a couple of questions coming in, but we'll keep that, as we mentioned, to the next, to the end of the presentations. So I'll hand you over now to Christoph and Elphas, who will give their 5 to 8 minute presentation as well on Kenya. Over to both of you. Christoph, I don't think we can hear you very well. Can you try it again? Nope. We can see your lips moving. Still not. Do you want to try unplugging or try without the headset? Okay, I think Christoph will restart the computer. Perhaps, Elphas, I don't know if you want to start at least introducing a little bit of a brief idea of the presentation and of your program. Thank you.
Maybe you proceed to the next slide. Christoph will attend to this current slide.
There we are. Can you see it, Elphas?
The next slide, please.
Okay.
Yes, thank you. You remember very well that in the mid last year, during the COVID-19 pandemic emergency, GIZ, in partnership with the Ministry of Health, conducted a successful COVID-19 response activities in Turkana West of Turkana County. The main goal of these activities was to raise awareness of all the households in Turkana West on COVID-19. The second goal for this activity was to distribute face masks and hand sanitizers to 300 vulnerable households. Part of the series of cash for work activities included local production of face masks and hand sanitizers. Using the very active community health structures in Turkana County, specifically Turkana West Sub-County, where we have fully functional level 1 structures. We have our community units in place with their supervisors in the name of community health extension workers. Below them, we have community health volunteers. And below the community health volunteers are households. So each and every household in Turkana West Sub-County has got a CHV who is actually representing us on the ground and offering basic healthcare services at that level. So immediately, as the first step in the implementation of these activities, we were able to train our CHVs, a total of 326 community health extension, community health volunteers. We did this after skipping the level of training of community health extension workers, because that had already been done by the county government of Turkana County. So we went straight and used our TOTs, those are the community health extension workers, and trained a total of 326 community health volunteers on COVID-19, all the necessary information that was relevant to be shared with that level of, with the community health volunteers. So we trained them on, for example, how this COVID-19 is transmitted, prevention measures of COVID-19 and so on. After that, we went ahead and identified 300 vulnerable households that were going to benefit with the sanitizers and the face masks. So, and as I said earlier, all these sanitizers and face masks were locally produced here in Kakuma, and that also made it available for those who participated actually, and still the vulnerable business persons also identified to be the ones to produce these materials, and at the end of the day, they handed themselves some cash. Having trained community health volunteers, these CHVs managed to visit various households that they are manning to over COVID-19 key messaging that had been produced by the national government. So we cascaded it down through the CHVs into the households with all the precautions, because part of the training was on precautions. So now the CHVs could prevent themselves from contracting the disease. So important to notice that this activity was implemented jointly by GIZ and Ministry of Health through CHVs and community health structures. Using this structure and this approach, we were able to achieve exemplary results within a very short time, and we managed to reach 19,391 people who were informed on COVID-19 within a period of about 1 week. Information already was with over 19,000 people. A total of 3,000 masks and 600 bottles of sanitizers were as well distributed. So that is what the two key achievements in terms of numbers that we were able to achieve. Next slide. Yeah, there were some lessons that we learned in implementation of this activity. I have here with me about 4 lessons learned. The fact that MOH-led implementation of this activity actually strengthens visibility, ownership, and capacity of government structures. The other lesson learned was that we really needed more time to implement this activity. Anyway, the fact that it was an emergency, it was we did it in a speedy way within a week, but we felt it necessary that it would have been more effective if we could have spent more time, maybe say about a month, so that we really reach the community which live in this sub-county, a very fast sub-county. Also, it is important to establish rapport and good relationship between various government organs or line ministries and various partners or non-governmental organizations working wherever, because during emergencies, you can simply and quickly channel your services through existing government structures. So it is important during normal to build that good rapport, good relationship, so that you can easily ignite and swing it into action during emergencies. And then working through existing government structures. Actually, it gives us a speedy way of implementing activities even during emergencies. If it is possible, we strengthen capacity of those structures that are on the ground, and then during emergencies, during any implementation of any activity, you can easily utilize those existing government structures. Yes, I think that comes to the end of my presentation. Yeah, I don't know if Christoph is back. He has connected the computer.
Christoph, would you like to come in and just add anything? I think we also skipped the first slide, so we can go back to that one as well, since we went to the second one, right, Elphas? Christoph, can you? We still can't hear you. Oh no, I'm sorry. Okay, I'm very sorry about that, Christoph. You can type to the rest of the group. But thank you so much, Elphas. I think you made a very strong point there about working through existing government capacities, and I think that's very welcomed. Just not in order to take too much more time, let's move on to the next presentation from Max from Ground Truth Solutions. And thank you for the questions. Keep them coming. We're assigning them to the different presenters, so we'll address them at the end. Thank you so much, Max. Over to you.
Thank you, Carla. And yeah, thank you for having me again. My name is Max. I work for Ground Truth Solutions. For those of you who haven't heard of us, we're an international NGO, and we work with and for people affected by humanitarian crises to make sure that basically their opinions, their perspectives inform the delivery of aid across different contexts. And to that end, we've spoken to thousands of people through a series of standardized interviews, all on the receiving end of all sorts of different cash and voucher programs to understand their perspectives, to really dig into their experience of those programs, and ultimately some of the technical discussions that we so often have. And that also includes, or in the past has included, understanding the extent to which the commitments of the Grand Bargain, for example, are being translated into meaningful change according to the perceptions really of aid recipients and humanitarian staff in the field. What I thought I'd do for today would just speak briefly about some of the findings from our Cash Barometer project and how they relate to the importance of keeping recipients informed. Next slide. Oh, no, that's the right slide, thanks. So what is the Cash Barometer? The Cash Barometers we call it our independent accountability mechanism funded by the German Federal Foreign Office. So an independent accountability mechanism for different forms of cash and voucher assistance. It's people-centered and based on perceptions of humanitarian cash recipients, meaning that it applies a mixed methods approach essentially to understanding the experience of cash and voucher assistance through a series of quantitative perception surveys, so some of those standardized surveys I just mentioned, and more qualitative approaches. And we take these findings, we try and make them speak to each other, and ultimately then come back to cash working groups in country. We speak to various coordination bodies in a dialogue phase essentially to inform ideally course corrections and improvement based on these perceptions that we're picking up on. The topic of today's webinar, which keeping recipients informed, is obviously an important area, not just to the Cash Barometer, but as we'll see, also to the recipients that we spoke to in 2 of the 3 countries that we're currently focusing our work on the Cash Barometer, which is Somalia and Nigeria. Next slide, please. So one of our findings, and it might strike you as a bit obvious, but more informed recipients are generally in our work found to be more positive. So in both Somalia and Nigeria, we asked respondents whether they feel the aid that they receive allows them to meet their basic needs, which you can see here on the vertical y-axis, and whether they feel informed about the aid available to them, which you can see on the horizontal x-axis. And you can see in both cases there's a Likert scale that we use, which is the same for both questions, so ranging from not at all, not very much, neutral to mostly and completely. In Somalia, around 58% of the 1,500 or so respondents that we spoke to said that they felt unable to meet their basic needs. So selected either not at all or not really on the Likert scale, the bottom or left 2 answer options. In Nigeria, the situation was a bit better. It was around 22% of the 2,000 respondents we spoke to responded negatively, which also showed a considerable improvement from the previous year, where 48% felt that they were unable, either not at all or not very much, to meet their basic needs with the assistance that they receive. Now, despite those differences, though, both contexts showed an interesting correlation between the extent to which recipients feel informed of available aid and the ability to meet their basic needs. That is to say, that as they feel more informed, they are better able to meet their basic needs, and vice versa, as we've tried to show in the graph that you see in front of you here. So just keep in mind, it's a correlation, not a causation. That's why I said vice versa. We cannot really say one causes the other. There's no indication of direction here, but it shows that they're undeniably linked, that when one improves, the other improves as well. Next slide, please. In Nigeria, specifically in Borno, we first asked respondents a fairly simple yes/no question, namely whether they know how aid agencies decide who receives cash and voucher assistance. So in effect, do you understand the targeting approach used by the cash providers from whom you were receiving your transfers? And in 2019, as you can see, 89% responded with no in Borno State, saying that they didn't understand the targeting approach. So we worked with the cash working group, we shared these findings, we had our dialogue phase, if you remember back to the first slide, and they then committed to really doubling down on efforts to better communicate some of these program details. And so we returned a year later to do a second survey, and we found interesting improvements across both metrics. So our survey in 2020 showed an increase in the proportion of respondents who felt they understood the targeting approach. It's not massive, as you can still see, it's still 80% saying they do not, but it's an improvement that you can clearly see. And interestingly, there'd also been an increase in the percentage of respondents who knew for how long they would receive assistance for. And as these numbers improved, as the recipients essentially felt increasingly informed about available aid, about the program structure, they not only felt better able to meet their needs, but also showed improvements in their perceptions of the fairness of aid. Next slide, please. Now, in most contexts we work, we also ask respondents to assess how fair they think the provision of aid is. That's a question that we adopted first when we were doing our work with the OECD on tracking the grand bargain implementation in various contexts. And since then, we've asked respondents across many different contexts whether they feel that the aid in their community goes to those who need it most. So a basic metric for fairness. Again, using the same Likert scale question, the same Likert scale answers that I showed you in the previous example. So not at all, not really, neutral, mostly, and yes, completely. Now what you see here is the extent to which there's a positive correlation between feeling informed about available aid and the extent to which recipients feel aid reaches those who need it most. So the extent to which they feel aid is fair, basically. And as you can see, the effects vary, but in countries more recently that we've worked on in Somalia, Nigeria, and Uganda, for example, there's definitely a correlation there. It's not incredibly strong, but we do see again that these two variables are linked. In other countries, that might not be the case, as is, for example, in Central African Republic. But in those countries, at least, we see that not only where recipients feel informed, they're better able to meet their needs and vice versa, but also where they feel informed, they feel that aid is distributed more fairly. I think intuitively, many of us will agree that that makes sense, where people understand how aid agencies determine vulnerability, even on a very basic level, because we all know that these processes can be incredibly complicated, where they understand how community members might be involved in the determination of who should and who shouldn't receive aid. They're more likely to feel that that process is fair. In turn, where they're kept in the dark about how recipients are selected, we can expect the opposite to be true. So those who qualify must sort of blindly accept what's given to them without further explanation from aid providers, and really with few options for recourse where they might face problems. And those left wondering why they didn't qualify for aid without understanding how that decision was made are really only reminded of that power disparity between aid providers and recipients. So in Nigeria, we're actually following up on the intersection between perceptions of fairness and targeting approaches. So in Adamawa, in Borno State, and in Yobe State, we just carried out a series of in-depth interviews with a few selected recipients. So some of those qualitative interviews that I'd mentioned previously, to understand on the one hand some of the changes that we've seen in cash recipients' preferences since COVID-19, but also to understand how they think about the notion of fairness when it comes to targeting. So what we've heard anecdotally from a few of these interviews already was that some feel, for example, that aid should be targeted specifically to meet the needs of the most vulnerables. Others are more convinced that aid should be provided to everybody in a community. And we're really trying to get a better understanding of what drives these differences in opinions. We're in the midst of analyzing these transcripts now, so there's not much more I can share at this point. but we will certainly draft a report very soon. And that just leaves the final slide. That's basically all from me, but I will happily share a few links in the chat for you to be able to look at our data, our reports, and please do reach out if you have any questions or ideas that you'd like to see explored in one of our project countries as part of the cash barometer. Thank you.
Thanks so much, Max, and thanks so much to all the presenters. I mean, I think one of the key aspects that comes out really critically from all of the presentations so far is how much communication with beneficiaries is critical. It's critical for the inclusion, for the correct inclusion, for the correct targeting. It's critical for the improvement of the program itself as well. It's incredibly important for fairness. I think Max pointed that out really well. And I think it's important also for feedback in order for us to then go back and improve the program even more after that design phase. So in my opinion as well, I think that there are three ways of how we're doing communication to beneficiaries in terms of the different programs and humanitarian cash and social protection. There's the aspect of communicating and including people on how to design a program in the very beginning stages, which we could see a little bit from the Serbia example as well. The second step, for example, is also in explaining programs, just how they've been decided, how has targeting been done, etc. And the third one is in getting feedback from people. So I think those are sort of some three critical aspects of communicating programs with beneficiaries. And we could see in Serbia, we saw the use of local networks to access local communities that I think Ranko and Anna described really well, using the network of the Red Cross, which is a very interesting way and great approach. In Kenya, we saw the example of sort of working through existing government capacities and really engaging with local government capacities to ensure that they're reaching out directly to the local communities. And in Nigeria, DRC, and other contexts that Max described, it's just really astounding and incredible how little people know about the decisions that we are making. And this is not just an agency specific, it's not a criticism, it's an overall comment that we as humanitarians and as social protection actors can be doing a lot better at that. So thank you so much for this. We do have a little bit of time to discuss the Q&As, and thank you all for your questions. I have been picking the questions and kind of sending it to different presenters. So I'll just give the floor to Anna and to Ranko, maybe to answer some of the questions related to their presentation. And then I'll come to you, Elphas, and if Christoph, we're able to hear you as well, that would be fantastic. And I haven't seen any questions from Max yet, but as soon as I do, I'll pop them over to him. So over to you, Anna and Ranko. Thank you so much.
Thanks, Carla. So I think we had a question on pre-distribution monitoring, whether it is the same as a baseline measurement. Thanks for the question. Indeed, the pre-distribution monitoring tool actually serves two purposes. One is to find out about the potential recipients of the cash transfers, and secondly, to also assess their level of vulnerability, as well as to understand their spending patterns at the moment, so that we can compare it to the post-distribution monitoring data. And there was another question on persons with disabilities being engaged in the process in Serbia. So I'll leave that to Ranko, if you want to take that.
Thank you, Anna. I have to answer it by typing. So we had information about the people with disabilities, and just I answered that we were visiting those people and families in their homes. So during the COVID-19 crisis, we were going to their homes, taking care of their safety and our safety as well. And in some cases, I can tell you that the Red Cross personnel has traveled for 50 or 100 kilometers in both ways. So we were paying attention on that. Maybe if I can answer on other questions. So the first question was about the who was involved in the final verification. So as I wrote, the headquarters of the Red Cross of Serbia was involved in the final verification process by specially trained CVA, specially trained staff and volunteers from national disaster response teams. So we really trained and CVA educated people. And something else, just a second.
There was one on managing field interviews to avoid a sense of discrimination.
Yes, I have answered that as well. So just to find my answer. So we something that we are having in within the movement and the Red Cross of Serbia, we are having a guidelines as so for community engagement and accountability. So before the project, we have paid attention especially to fulfill these guidelines, and we have protocols for feedback mechanisms and communication with beneficiaries. So this is how it was handled on the local level. And also additionally, we have printed with UNICEF, we have printed the leaflets and posters where all informations are put there for their information and contacts additionally that they can contact UNICEF in their headquarters and the Red Cross of Serbia in our headquarters if they need more information out of their community and their municipality. So this is how we were handling all of this.
And if I may just add one line to that, at the outset, we had selected basically households who had been rejected for financial social assistance and child allowance by the Center for Social Welfare, i.e. the government. So in a sense, a lot of the discriminative perceptions may have been avoided actually because of this one criteria. And of course, the Red Cross additionally made sure that people felt comfortable enough to participate. Over.
Great, thank you guys so much. Elphas and Christoph, there were some questions also addressed to you. I don't know if you're able to, if you'd like me to read them out, let me know.
Yes, I saw one of the questions on how we will manage to engage persons with disabilities in our activities. I hope that was the question. And in my response, we have managed to build capacity of our CVs. That's right from the initial trainings of our CVs after recruitment. We have a module on disability, and we managed to train them. And after this training, they have been able to identify all the households who have persons with disability. So we have the database of these persons, all these households. And when we were doing our implementation of the activities during the COVID period, we managed to visit the households as a priority. And then secondly, we gave them priority during the distribution of those commodities, because there were some households that we were targeting, 300 households. So we managed to have persons of disabilities among us 300 households who benefited from the hand sanitizers and the face masks. So we really included them in our program as from the World Core household visitation and benefiting from the commodities for COVID-19 prevention. Thank you.
Great, thank you so much. Christoph, would you like to try and add anything? No, we still can't hear you. That's very frustrating. Okay. Max, after I said that I don't see any questions, I actually realized there were quite a few questions for you. Let me know if you'd like me to read them out to you, but I think you've got them in front of you, so please feel free to address them. Thanks.
Sure. So Pontus had a question around the characteristics of individual groups who responded to our question. Generally, our surveys are carried out with recipients of humanitarian aid. We don't typically dig much more deeply than trying to understand what types of humanitarian aid they receive. We don't cross-reference from which organizations. So that also speaks to Carla's point previously, that this is not sort of a critique of individual organizations, but rather this is, as the name barometer sort of suggests, it sort of takes the pulse of perceptions across an entire humanitarian response. So we know that the respondents to our surveys are recent recipients of aid. We have a number of demographic characteristics that we understand on their part, as well as the types of aid they receive, whether it's cash, whether it's in kind, whether it's a combination of those. We often also ask whether they've made a complaint, and all of these things, as Pontus sort of suggested, allow us to break down, and really across different countries that produces very different results. So as you might expect, we often find regional differences in terms of people's sense of feeling informed. We find differences in the status of the respondents, whether they're displaced people, whether they're host community members. So those things always reveal certain different tendencies, whether they're more or less likely to feel informed, but I can't really speak to an overall trend that cuts across all different contexts. In terms of the point made by Chris, we generally work with local organizations to strengthen their capacity in certain contexts. We do that in Afghanistan at the moment, but we're also looking to do that in the cash barometer countries that I mentioned. We also, I mean, you can find all of our reports online. We're happy to share our data under the right circumstances, so in line with some of our data management principles. And yeah, also very happy to share some of the COBO instruments if that's of interest. So please do reach out. We'd be happy to share any information that we have that you might need. The next question talked briefly about like the evaluation of different channels and what is more or less effective. It really varies. I mean, we ask these questions. So what are people's preferred channels of information? We also ask when they have questions, who do they reach out to typically? As you can expect, that varies from country to country. I have opened, for example, the Somalia report, but there we see, for example, that for many, since the 6 months before our survey, so in the time when the pandemic really picked up, we see a strong change in the way that information has flowed to them from humanitarian aid providers. Lots of them are saying, well, obviously because of the social distancing requirements in Somalia, that they now receive less information. And when they do, it's also less direct. We often see that face-to-face, obviously that's difficult now, but was always the most preferred form of information, of receiving information. And yeah, those preferred sources of information are typically local. So it's things that are familiar to them anyway, things that through which they already receive information. In terms of the degree and depth of information as shared by humanitarian actors, it's a good question. And that's something that we really use our qualitative approaches to try and dig in more deeply. I think it's fair to say, based on some of the findings I showed today, that in some contexts, recipients definitely do not feel that they receive enough information, but we don't really cross-reference that with what information they have actually received. So what we do is take these findings to different organizations working in those areas, and we try and collectively come up with some course corrections, some improvements that might help to mitigate some of these negative perceptions that we're seeing. And I guess the response to that final question around what are the best solutions to keep humanitarian aid recipients well informed about selection criteria, it's always an interesting one, and it's always one that comes up because it is quite a tricky issue as to how to explain selection criteria. I guess, I mean, one could almost turn it around and say the best selection criteria are those that you don't have to explain, meaning that ideally they're created through the participation of recipients, and therefore don't need elaborate statistical formulas that you know, to be honest, even I have difficulty understanding sometimes. Thanks.
Thank you so much, Max. And I think that really gets to the heart of it. I mean, there are examples in Lebanon, for example, Jordan as well, where the targeting is just so complex and it's full of econometrics that even we as humanitarians or social protection actors might really struggle to explain. And I think a lot of the questions, a lot of the answers that have come about in the session are really interesting, because it's not just about the humanitarian responses and how we're communicating, but governments, local governments, and humanitarian actors that are looking into linking with social protection also need to be looking at it from the social protection aspect as well. So there are a lot of similarities between how do we communicate, how do we include the people that we are aiming to target, aiming to support, aiming to assist, so that they can better understand our programs, be involved and actually be a part of how that program is designed, but also how we can improve it as well in the future. I did have a question to all of you, which I think is a little bit more about how did, in your view, did the communicating with beneficiaries improve your program overall? And one of the things that you mentioned, I think, Max, which I thought was very interesting, is the preference, right? There's a lot of discussion as well about technology, improving the way that we can actually get feedback from recipients, but also how we can communicate better with them. People are on their mobile phones, they can access a lot of information on Facebook, on WhatsApp, on different systems. I know WFP, UNHCR, UNICEF, and different agencies are looking into more technological aspects and ways to communicate with their recipients for humanitarian programming. But it's very interesting to see that also in some communities, people prefer the old face-to-face. I mean, it's the way that people feel like they really can trust where the information is coming from. So maybe just a last little question from my side to all of you, if you can keep it short and brief for those of you who've implemented programs. How did communicating back or including people in your programs, how did it improve them from your side and in your opinion? I don't know, Anna, Ranko?
Yeah, Carla, maybe I want to mention something related to this communication using the new technologies, etc.
Sure.
Just not to forget that we are working with most of these people are socially vulnerable, and their capacity to use the techniques, technology. It is a question: would you get them on the phone? Will you find them? Are they having a phone or etc.? So it is really, yeah, it helps to use the technology, but again, the field work and the direct contact with them, it's the final way to communicate with them in person. Yeah.
No, thank you. I think that's a really important point as well. Now, I just wanted to allude to that because technology does come up a lot in how do we communicate better, and I think that face-to-face is still very much needed at the end of the day. Anna, did you want to add anything, or Elphas?
Nothing from my side.
Okay, great. Elphas, Max?
Not really, nothing from my end.
Maybe just a short point. I mean, we're not implementing, but we do notice the benefits of also then communicating back our findings, which often, I guess, helps to tackle a form of survey fatigue that obviously we're mindful of contributing to, simply because we try and get information from people who are often targeted for information, and it certainly does help us. We've seen it in different contexts when we find ways to communicate back not only the findings of our work, but also what we intend to do with those findings.
Absolutely. No, I think this is a very important point, and it's a topic that I think will keep coming back. We've discussed it many times, and I don't think this is the end of it. I'd like to take the opportunity to just thank all of the speakers. I'm looking at the time, and I think we've just closed, come up to the end of our time. So thank you very much to the presenters. Thank you to the audience for your questions and for your engagement. We will be, if there's any questions that we haven't addressed, we will be sending you the Q&A, and we will be popping it on the link as well on sp.org. We would like to remind you as well that there is a feedback survey that will pop up on your browser after the end of this webinar. So please complete that feedback survey. So just linking to the topic of this discussion, you are a recipient or a beneficiary of these webinars. So we would like to hear from you so that we can also continue to improve the topics and the webinars that we continue to do. Thank you so much to everyone. This is all from my side, and see you next time. Take care.